Hi YouTube, it's Dr. Margolin here again. Thank you for all the support we got, for everybody who subscribed, who put likes, who contacted us with questions. We actually got quite a few questions. We were encouraged to submit more. One question that repeated itself several times, I'll a little bit change the wording, but I communicate the message. The question is like that: look, I know I may have a bad habit, or I'm involved in some kind of drug-seeking behavior, experimenting with stuff. But, I heard if I quit cold turkey, I'll go into terrible withdrawal, I'll be sick like a dog, most probably relapse, and then it will get worse. And some people even said that they heard people die from withdrawal. So let me clarify this issue. It's a very good question, and I'm going to clarify it. And the second question was, I looked at your videos, and it's true, I'm experimenting with substances and people around me, but I'm not an addict. As you said, there's no functional impairment and other stuff, so I think I'm safe. And this is a big mistake. I'll just tell you about the second question. It's a big mistake. You can die from overdose even though you're not an addict. It's not related. Some people die from their first dose, and I'll explain that in a separate video. But today I want to address the first question about withdrawal. So what is withdrawal? Why we get withdrawal? How to deal with that? Let me talk about again two types of situation. First, when we deal with about a habit, but there is no chemical component to that. For example, addiction to video games, or some people can be addicted to bad food. Sugar is one of them. How I stop that? So there are two general approaches in doing that. First, you need to understand that you need to do that. Secondly, you need to do stimulus control. You need to stay away from anything that can trigger you to this bad behavior. Throw away your video game device, lock it up, don't buy sugar products. And then you need to replace it with something positive. In a nutshell, how you replace it, for example, exercise is a good exercise, an excellent replacement. There is more to that, but I want to get to the second part, which is was the main point of those who asked the question, which is withdrawal when you take opioid substances. And this is, by the way, somewhat related to alcohol, but since opioid problem is more prevalent, I'll concentrate on that. Why it happens, how it manifests itself, what you do about it. First, when you take addictive substance, it not only gives you high and then gives you withdrawal symptoms, it actually causes biochemical changes in your brain. It affects certain areas in your brain, for example, nucleus accumbens, some other areas in the brain, and then it also changes the number of receptors in your body. That's why when you abruptly stop the substance, you feel withdrawal. And withdrawal can manifest itself in many different ways. It can come up as nausea, vomiting, as tremor, paroxysmal sweats, which is autonomic nervous system type of phenomena, anxiety, which is emotional phenomena, goose flesh, restlessness, and it can progress to agitation, tactile disturbances, auditory problems, visual disturbances, headaches, lacrimation, nasal congestion, yawning, abdominal pain, diarrhea is common, feeling of change in temperature sensation, muscle ache is very common, and very important, pupil dilation. Opioids caused your pupils to constrict, and withdrawal would cause your pupils to dilate, and it's very easily noticeable. Now, you tell me, hey, it looks very scary. Maybe the guy who asked the question is right. What you can do about it? So, one answer, don't deal with that alone. Don't deal with that alone. If something like that develops, you really need to go to the nearest emergency room and let doctors help you out. I'll give you some information that can help you to plan this and make it more gradual and easier for you. First, this is uncomfortable. I agree with you. It can be uncomfortable in certain situations. It really, very really would threaten your life, almost never, and in very extreme cases. But continuous use always threatens your life. So there is really no reason to continue dysfunctional, addictive behavior because you're scared of withdrawal. What can you do to prevent withdrawal? Now, there are certain medications on the street, and we're well aware of that are sold to help people prevent withdrawal. Gabapentin, supposedly one of them. Suboxone is another one. And generally, there is some logic into that. And both medications may be used, Suboxone, for example, but it needs to be used in a proper environment, in a structured program. So I think you need to, if this is your question, this is your problem, you need to seek help. You need to establish a relationship with a provider. You need to plan it, discuss it, and you need to take care of the biochemistry. There are several medications that can be used to help with withdrawal. Clonidine is not clonipine, clonidine is one of them. Baclofen is another one. We mentioned Suboxone, we mentioned gabapentin. There are other protocols that involve other medication like tramadol. Each place has its own protocol, but it can be managed fairly well. Most of the time people do get some discomfort, but it's not life-threatening, and it's definitely not the reason to continue abusive behavior. Now, the question about relapse. Relapse can happen. Unfortunately, it does happen. But again, it can be managed. And sometimes by going through that and keep on trying, you actually become clean and you actually achieve true independence and true cure. Look at the thumbnail to the video. It's actually very interesting. You know, it's a mountain creek in Yosemite, and when you walk to the creek, it's almost unbearable to walk bare feet because the stones are very pointy, they're sharp. But as you walk into the water and you walk towards the middle of the creek, it's very easy to walk because guess what? The stones become smooth. And it's crazy, you know, the stone is so strong, how water can make the stone smooth. It's just continuous effort. I found in my practice, continuous effort almost always gets major improvement and cure. So there is no reason to be scared of withdrawal. Go to the emergency room if you're concerned. If you have more time, establish relationship with a specialist, find a problem. You need some medications, you need psychological support, and again, this continuous effort, and you will be fine. Again, this is for education information purposes. For each case, you need to seek advice of the qualified provider. And if you like the content of this video, we do it as volunteer work. We've seen between 4 of us more than 40 patients today, and we stayed here to prepare it for you. Please smash this like button. Please share it with everybody else. Thank you again for CPMI team, for Daniel Margolin, for other people who helped. Thank you very much, and this to be continued.
Hi, my name is Joanne Austin, and I've actually been coming to Dr. Margolin's office going on 4 years. I'm very pleased with him. He's a very good doctor, and he's really concerned about our pain and how we feel inside. He's very good at what he does, and I can totally feel the difference anytime I take my medication and follow his instructions. I will always be on the best path I can possibly be on.